Do you have shoulder impingement or pain in the front of the shoulder? In this video, I'm going to tell you how to assess for shoulder impingement and a couple exercises to help decrease pain and improve mobility. Shoulder impingement can affect daily life and gym activities. Oftentimes, people are told to rest or ice, but that's not going to fix the root cause. Others are told to get an injection so it can take out the inflammation. This might temporarily work, but it's putting a band-aid on a much bigger problem. How do I know this? Because I'm Dr. Joey Seyforth, and I've helped thousands of people with shoulder pain fully recover with our one-on-one coaching program. Many of these people have been misdiagnosed with shoulder impingement or given the wrong game plan on how to fix it. Before I get into a simple assessment to see if you have shoulder impingement, let's talk about what shoulder impingement actually is. Shoulder impingement is a broad term that's utilized, but there's usually a couple of sources of the pain that are going on. One common tissue that's being compressed is your supraspinatus tendon. This is one of the 4 rotator cuff muscles, and it's getting compressed between the shoulder and shoulder blade. Another tissue that can be impacted in shoulder impingement is the shoulder bursa, which is a fluid-filled sac that's getting impinged when raising the arm out to the side or overhead. Check out this common test for shoulder impingement. It's called Hawkins Kennedy. To complete this test, you want to bring your arm into forward flexion, bend at the elbow, and provide overpressure to bring your arm in this internally rotated position. A positive sign with this test is pain in the front of the shoulder right here. Compare it side to side to see how it feels. The position of this test puts the shoulder in a compromised position and compressing all the structures in the front of the shoulder. Now that we've gone through the shoulder assessment for impingement, what's next? Check out these 3 mobility exercises to help clear up the space in the front of the shoulder and get you moving and feeling a lot better quickly. The first exercise is called a ball posterior capsule mobilization. You're going to grab a tennis ball, lacrosse ball, or baseball and head over to the wall. Next, you're going to place the ball in between your shoulder blade and the wall, and then you're going to bring your arm across your chest, pulling it through with the other arm. You will most likely feel a stretch in the back of the shoulder, but do not force this into pain and go with whatever motion that your shoulder has available. 20 reps of that exercise usually does the trick. Next exercise is for the T-spine. What you're going to do is you're going to go over to the wall and get into a half kneel position. The knee that's furthest from the wall is going to be down. Next, you're going to rotate your hand away from the wall, following your eyes with your hand and opening up the shoulders. Make sure the hip stays connected to the wall, and you want to shoot for 12 reps on each side. Do not force the motion, but go with whatever motion feels fine for right now. The last exercise is a chin tuck, and this is going to help clear up the neck mobility. What you're going to do is you're going to use 2 fingers to help guide your chin into a retracted position. You want to make sure that you're not going into a flex position or extending all the way up, but working straight back and feeling that stretching and pulling in the back of the neck. Complete 3 sets of 12 with a 2 to 3 second hold with this exercise and feel all the pulling and stretching in a good way. Now that you have completed the exercises, the next step is to retest that initial assessment with the Hawkins Kennedy. For the test, you're going to go into that same position. You're going to flex your arm, bring it in front, and provide overpressure with the other arm. You want to see if you have any changes in your mobility, meaning if you can go any further, or if you're having less pain with it. Improvements in this test is showing that the shoulder is able to get into further ranges of motion and improved mobility just from those 3 exercises. Those 3 exercises alone are very good at calming down the shoulder, but should not be the only part of your programming. You should have functional mobility and strengthening exercises to make sure that you're checking all the boxes. By doing this with also a structured program, you're able to get your shoulder in all different positions that you're going to get into inside the gym or outside in daily life. And you want to make sure that you're able to fully move through these positions without pain or limitations. Now, let's just say you didn't get any improvements in either the range of motion or pain. That could mean that there might be something else going on, that you're truly not dealing with shoulder impingement. If you're dealing with another root cause, these exercises are not going to fix it long term. That's why having an accurate assessment is absolutely necessary to get down to the root cause and build a game plan to fix your shoulder pain for good. Our clients on average get an improvement of 30 to 40% during that initial assessment call, and some are pain-free in as little as 15 days. Trying different exercises on the internet might give you some short-term relief, but if you're looking for a long-term fix for this, text the word pain to 720-710-4371 to get a tailored step-by-step approach on how to fix your shoulder pain for good. The people looking to get out of shoulder pain are texting me right now. What's holding you back from taking that next step? Please like the video and subscribe to the channel for daily videos on shoulder content and rehab.